Okay, midazolam, also known as Versed. This again is benzodiazepine. Action, same as before. Binds to type A GABA receptors. Okay, so again, what are our indications? It's benzodiazepine, so it's going to be about the same. Well, not about the same, exactly the same. Indications are anxiety. Let's qualify that to extreme anxiety. Seizures, abnormal seizures, status epilepticus type, seizures lasting minutes long, or continually recurring seizures where there's less than a minute of time in between. Also, sedation. So Versed, what are the times we sedate? We want to sedate for and pain control for cardioversion, if we have time. We also want to sedate in RSI instances or events, because to paralyze a patient while they're awake, it's not a good thing to do. That's only going to make anxiety even worse. They're already anxious, they're already in a bad way. We don't want to make things worse. So always sedate before you paralyze. Okay, contraindications. We're going to call it allergy or history of hypersensitivity to the drug. I think we've heard enough about hypersensitivity or allergy. We all know what it is. We're not going to give it if they say they're allergic to it or have a history of being hypersensitive. Okay, so dosing, 1 to 5 milligrams. Of course, this is going to be IV, IM, IO. No PO, no rectal, no oddball, anything with this one. Pretty straightforward, IV, IM, IO. Our adverse effects, things we want to watch for, things that we need to keep an eye on. Hypotension. We want to watch that blood pressure. We want to make sure we're maintaining it, or the patient is maintaining it. We don't want to cause a hypotensive event or make anything any worse. Sedation. Okay, exactly what are you trying to accomplish? Are you trying to sedate? Then sedation is not an adverse effect, it's what you want. Are you trying to relax or rectify anxiety or seizures? Then sedation may be a bit much, maybe a bit too far for that. Amnesia. Okay. Honestly, amnesia, I don't know if that's an adverse effect or not, because you don't want them remembering. In an RSI event, you do not want them remembering the event. You do not want them to remember being paralyzed or being intubated. So that I would consider to be a desired effect. Respiratory depression. If you're relieving seizures or relieving anxiety, that's a bad day. You don't want that. If you're RSIing, this is not a concern because you have made the conscious decision through RSI to take away that person's ability to breathe through paralysis. So this is not a problem. Now coming out or going under, nausea, vomiting. You never want those. Nausea is okay, but vomiting, you don't want vomiting, especially if you're RSIing and you're in the middle of RSIing. Probably not your best thing, or not the best thing to have happen. Again, like other benzodiazepines, flumazenil or Mazicon is your reversal agent. We do not reverse these, not without being in the emergency room and under direct doctor's order. We'll talk about it more in a bit.